Abdul Baker joins us today to talk about it. Thank you, Dr. Baker, for being with us today. Can we talk about what hydrocephalus is? And there's also a complication associated with it, right? Can you just jump in?
Sure. Hydrocephalus in general terms means that there is an accumulation of spinal fluid within the brain. Typically, there are two different aspects of how the spinal fluid is accumulated in the brain. One is you have lack of absorption of the spinal fluid, so the spinal fluid collects versus being absorbed by the body in a normal sense. So it affects the brain in a negative way that way. Second, you have actually an obstruction, like a tumor of some sort that obstructs the flow of spinal fluid that is supposed to circulate from the brain to the spine. A regular person creates around 450 cc's of spinal fluid every single day. But at any given time, a person has an average of 120 to 150 cc's of spinal fluid at any time. So most of that the rest of the spinal fluid is absorbed. So if that balance is off, you can have accumulation of spinal fluid in the brain that results in brain compression, which results in various types of neurologic manifestation.
Now this sounds terrible, but is there actually going to be a sign that this is happening, or do we just have to wait until something goes wrong with those other neuro manifestations?
Sure. Vast majority of the patients, the manifestation of worsening hydrocephalus is an insidious onset of headache, some difficulty with vision, and cloudiness of mind, and slight grogginess, and that is progressive. The only exception to that insidious onset is patients who have a brain aneurysm, for instance, and or any other stroke that results in bleeding in the brain. That system of spinal fluid circulation can be acutely blocked, and that is acute onset of bad headache, and a person declines quite rapidly compared to a slow onset of these symptoms.
Gosh, and quickly now, how do we treat it?
Typically, if the cause of hydrocephalus is reversible, like if there is a tumor that is obstructing the outflow of the spinal fluid, the treatment would be remove the tumor and you resume the outflow. If the absorption system is impaired, then you actually have to mechanically create a path from the brain to somewhere else in the body where the